Good afternoon, Leadership Coachella Valley. This is Sean Webb. I am the Director of Community Engagement for Desert Sands Unified School District, but also another hat I wear is I am the Board President for the now longest year in Leadership Coachella Valley history. Usually our Board Presidents stay on for 1 year, but we are continuing the year on because of the current conditions and so forth. But here we have our health leaders for our first lunch conversation that is completely centered on healthcare. And as you can see, we've got some great health professionals with us today. I'm going to go ahead and we're going to kind of bounce around the screen here and have them introduce themselves, and then we'll go ahead and continue with the questions. To my, I guess, looking at the screen, to my right, we have Susan. Susan, why don't you go ahead and introduce yourself and give us a little bit about your background and so forth.
My name is Susan Cadle. I'm the lead school nurse for Desert Sands Unified School District. I've been a registered nurse for almost 30 years. A school nurse for 9, both in West Virginia and in California. That's me.
Okay, excellent. And we'll get to you, but I'm sure to get some school questions coming forward here too. Next to you, we have CJ Toby. CJ.
Thank you, Sean. CJ Toby. I'm the director of the Community Health Department at Desert AIDS Project. I just celebrated my 5th year here at DAP. 5 years ago, I actually started as a case manager on the front lines, and now I'm in administration. It's wonderful to work here and serve the community. HIV and Hep C, STD testing, linkage to care, education in the community, and then I'm also involved with some clinical operations, as a lot of the programs in the Community Health Department are integrated into our clinical setting here at DAP. And I presented at Leadership Coachella Valley, I believe it was last December. I was honored to do that, wonderful group of people. And I'm happy to be here today. Thank you.
Excellent. Thank you, CJ. And below you, we have Rich Ramhoff, who's also one of my past school parents from Page Middle School, as we were just reconnecting. Rich, how you doing?
I'm doing well. I'm Rich Ramhoff, and I am Group Director of Marketing for Desert Care Network, which includes the hospital's Desert Regional Medical Center, where my office is today, and JFK Memorial Hospital in Indio, and then High Desert Medical Center up in Joshua Tree. And obviously, I was with Leadership Coachella Valley many years ago in 2009. I actually was at the Desert Sun newspaper at the time, switched over into healthcare in 2010, and now with Dr. Williamson Eisenhower, we're on the front lines of the COVID situation. I think some of our experiences are going to be pretty similar, but needless to say, a lot of changes in our lives since this started.
Yeah, definitely. We'll definitely get to that. And Dr. Alan Williamson, if you could introduce yourself to our viewers and so forth.
Hi, Dr. Alan Williamson. I'm the Chief Medical Officer for Eisenhower Health. I'm a vascular surgeon by training and have been in the desert for 30 years.
Excellent. Thank you for joining us. And below me, we have Patrick Hallisan, who I know is having some technical issues, but we're going to go ahead and try and have him introduce himself. Patrick, I think you're muted. Okay. Go ahead, Patrick. Okay, unfortunately, Patrick's having some technical issues, so hopefully we can get back to him later in the conversation. So, you know, I'm going to get right to it. We have this healthcare focus panel today. And one of the questions we've been asking of all of our people during lunch conversations is, how has life changed for you personally, as well as professionally, since March 13th? And the reason why I used March 13th is that was the last day of school in the Coachella Valley, and I work in the school district. So why don't we go ahead and start off with CJ, if you could share how have things changed with you in your industry, in your business and so forth since March 13th?
So I can say personally, my personal life hasn't changed much because I'm an introvert and I'm currently working on a master's degree. So I think it's the perfect time to really continue your education when we really can't be social or doing any community events. From an agency standpoint, I would say we really pivoted the 3rd week of March when the COVID crisis was really hitting the Coachella Valley by opening a COVID-19 triage clinic to help alleviate any traffic that was coming into any of the area hospitals so they could focus on the very sick and symptomatic patients. That would be one of the biggest things I think the agency has done, but it's more so just adjusting to the workload of us already tackling, the systemic barriers and just providing access to people who need medical care and services, and trying to keep our eye on that while also simultaneously combat COVID-19. So that's been our biggest challenge, and something that we continue to plan for the best we can and adjust every day.
Yeah, most definitely. Well, thank you for all that you do, and we'll continue over to Susan. Susan, we both work in the same school district, but maybe you can share a little bit how things have changed for you.
So personally, I went from having an empty nest to having a full nest again because I have 2 college-age students. Both were in college in Virginia, so the logistics of getting them back home took some doing. But from a professional standpoint, nursing and education is a little different anyway, but continuing to attempt to connect with those families remotely, either through a Zoom or Google Meet or over the phone, to make sure that our families had everything they needed as far as being in touch with their providers and those types of issues has been challenging at times.
Yeah, definitely. I agree with you completely. And I'll just share quickly in regards to my changes and so forth since March 13th. I'm the director of community engagement. I'm used to going into businesses and talking to business owners and so forth. So as I shared earlier with you guys backstage, I kind of stole this idea from Katie Stice from the Rancho Mirage Chamber of Commerce, where we're doing this to engage the community in Desert Sands. And it actually has turned into every Tuesday and Thursday, we have a morning show called Classroom Conversations, where we share everything going out in regards to anything going on in education. As you guys are changing by the minute, we are changing by the hour. So most definitely. And Dr. Alan Williamson, if you could talk to us about some of the changes you've experienced since March 13th.
Certainly since March, I have become, along with Rich, a reluctant TV star. I certainly wish I wasn't on the news seemingly every night talking about where we are with COVID-19. Obviously, that has absorbed an enormous part of my work life and home life. Like everyone else, I'm now a homebody because really there's nothing else for us to do. But basically every day we're just trying to stay on top of this. Every day is a new challenge. Starts with PPE, turns into testing, turns into having enough rooms, having staff, etc. So every day is a new challenge for us.
Well, thank you for everything you do, Dr. Williamson, and I love it when you guys are giving updates on the news and so forth. So thank you for that. Greatly appreciate it. And Patrick, I think we got you all situated now.
Yeah, it looks like I'm back in. Sorry, I was having some audio and video trouble. I'm here in the clinic, and my office sits right adjacent to radiology, so I'm wondering if some of that interfered. But here we are. So thanks for having me.
Excellent. If you could just quickly introduce who you are, who you work for, and then maybe talk about some changes since March 13th.
Since that infamous March 13th, absolutely. My name is Patrick Calasan. I work for Kaiser Permanente as one of the assistant department administrators. So I'm part of the leadership team that leads and manages our 3 outpatient clinics here in Coachella Valley. Palm Springs, Palm Desert, and Indio are our 3 clinics out here. So March 13th was an interesting day. I think that's when the school districts announced closure for all of them. And of course, that impacted all of us in healthcare. And we had to make some difficult changes ourselves, trying to keep our members safe, trying to keep our staff safe. And so everything that we've done is in line with CDC recommendations. Everything from coming into our buildings, people are being screened for temperature checks and symptoms. We've ramped up all of our EVS and maintenance folks so that there is cleaning through the day, disinfecting through all of our exam rooms, through our waiting rooms, to our pharmacies, and even reception check-in areas. The biggest change really is how our flow is at each of our clinics. We do maintain social distancing, so even in reception lines, we've got 6 feet between people. Our waiting rooms have been reconfigured so that unless you're from the same household, you're not sitting right next to someone. So that impacts the number of people that we can have in the waiting room. And at times we have people waiting out in their cars, waiting to get into an exam room.
Okay. Okay. Well, thank you very much for sharing that. I greatly appreciate it. And Rich, if you could share what's going on with Desert Care Network in regards to changes, and then you personally changes since March 13th.
Sure, sure, absolutely. Well, I'm on the marketing communications side, so that was pretty interesting portion of healthcare. Part of our job was to get, professionals out speaking to the media. But interestingly enough, when it first hit, a lot of our traditional marketing, went pretty quiet. If you think about it, healthcare providers do a lot of seminars, they do a lot of events during those times of year, and that all pretty much stopped. So it was interesting. We kind of all had to go very much internal. Everything became focused on things like PPE, but also communicating internally with our own staff, making sure they felt confident in what was happening. One of the early things we had to do was change a lot of our rooms into what they call negative pressure rooms, so that if someone's in sort of in that area where their person's under investigation, they may have the disease, they've got respiratory symptoms, they need, we had to upscale the number of rooms available to put someone into that isolation area. So we had to communicate when that was happening, how it was happening. Staff needed to know those things. So early on, that was one of the biggest changes. We kind of got very centrally communication focused on staff. And then we started to tell the stories of our doctors and nurses and providers. That's what our social channels became very early on in the pandemic. We've now, come a long ways, and I think we're getting not back to normal, but whatever you might call a new normal. There are things we need to message now. Interestingly enough, we noticed early on that people were avoiding coming to the emergency department, even if they were having things like symptoms of a stroke. It's like,
Wow.
For God's sake, guys, we've got it under control. If you're having a stroke, don't let fear of a respiratory illness stop you from coming for care. So we did some messaging on that area too, which was very important, because it was very strange to see. You wouldn't think that the number of heart attacks you were seeing in the emergency department would slow down, but holy cow, the doctors are saying, we think people are just staying at home, and that's terrible. So anyway, That was an early messaging thing that really struck me, that we had to get out the message.
Okay. And at this time where we have this platform and format, if any of you want to ask one another a question about what we're talking about, feel free. I know we don't have like a hand option in Zoom, just kind of do one of these and I'll make sure to call on you. That'd be great. I'm going to go up to the next question that I brought up to you. Are there any special programs, initiatives, and so forth that maybe we should be aware about that your industry's has right now? Why don't we go ahead and start off with Susan? Is there anything that you want to share about in regards to that?
So no new initiatives as far as the nursing department, and Sean, you're probably better versed on what the school system as a whole is doing and has done. You've done a great job with handing out meals to families, and I believe that's been a huge benefit to the community. The one thing, kind of piggybacking on what Rich was saying, that I've discovered is that children aren't getting their well child visits from their pediatrician. And so immunizations haven't been given or falling behind. And unfortunately, the state has not changed those guidelines. They're still required for school entry. So that's one of the things we've been working on with registration to school, is how can we get those students caught back up on their immunizations, and working with the providers to make sure that those immunizations can still be administered. I do work with the return to school plan, following with the California State School Nurse Association and their guidelines. Everybody seems to have their own guidelines, and kind of bringing them all together for something that works for us in our district.
Thank you very much for sharing. And Dr. Alan Williamson, if you could talk about any specialized programs, initiatives, and so forth that's going on with Eisenhower.
Thank you. There's not a lot of particularly special programs going on. It's really just, again, trying to keep up with the volume of the cases that are coming in. As Rich said, we certainly saw an issue early on where patients were avoiding coming to the emergency department. So we've had television ads, newspaper ads, and so on out there, and talking to the media to be sure that we really do reassure the public that it is safe to come to the hospital. And I think we've seen that turn around pretty significantly. Our ER volumes are back up to much more typical volumes for the non-COVID things that indeed in the first month really just evaporated, surprisingly so, to a surprising degree. I think a lot of people are aware we have a military team here that's helping us out that came from the U.S. Air Force. They've really settled in extremely well into the institution, been very helpful to us. They were extended an extra couple of weeks, so they're going to be here basically through the end of this month. So that's been very, very helpful to us as well. Testing continues to be a challenge. We'd love to be able to really expand our testing capacity and start testing a lot more asymptomatic people in the community so we could understand a lot better where we're still seeing pockets of disease, how we can try to target those areas. But unfortunately, still a real challenge getting the testing kits, the reagents that we need to be able to perform the tests. Unfortunately, a lot of the companies that produce those are beginning to gear up for the fall, where they're going to start seeing flu as well and other respiratory viruses along with COVID. So they're re-engineering their testing supplies and testing kits to be able to accommodate those tests as well. But in order to do that, like any other industry, they then basically have to shut down their production while they're retooling. And in a time where we basically have no back supply of all of these testing kits, they were producing them and shipping them basically, really essentially the same day, and we were using them the next day as soon as they would arrive. So it's really kind of crippled us again in terms of really expanding any testing for the time being.
Okay. Now, you brought up one fact there that the military is coming in to help and so forth. So I just have a basic question. So I don't know much about medical. I've never worked in the healthcare industry. But I know in education, we have a lot of acronyms and terms that even from district to district are different. So I'm wondering, with the terminology, with somebody coming into a facility that never worked at, how is that kind of work?
Now, fortunately, the physicians and nurses that we've been dealing with, they were physicians and nurses first, and then they became military people, military personnel. So they understand our lingo. Now, we've had to accommodate a little bit of their lingo. For sure, there are a lot of acronyms and titles and so on that we're trying to get straight and be sure we're all speaking the same language. But they did an amazing job of really settling in very, very quickly. We did basically a 2-day orientation with them.
Okay.
And they really hit the ground running and have done an excellent job of really fitting in and pitching in and helping in a big way, giving particularly the nursing staff a little breather for a change. The nursing staff had really been working essentially nonstop since this started, and this gave them a chance to really step back, rest a little bit, and get ready for the fall.
Okay, I got you. Yeah, I could tell you from the school standpoint, I've seen over at La Quinta High School and Indio High School, they have the National Guard coming in with Fine Food Bank, and I am just amazed that they come in. It's a fine oiled machine that they're able to just come in and get things done, and I'm just amazed with what I'm seeing there.
And a great attitude. They arrive with
exactly.
Basically, you tell us what you need done, we will figure out how to do it.
Yep.
So it's a really refreshing attitude to work with.
Yeah, definitely. Why don't we continue on along the bottom here? Patrick, why don't you share any specialized programs, initiatives, or anything that are going on specific to COVID?
Similar to what I've heard, there's no new programs. I think we're fortunate in Kaiser Permanente that, our electronic records are pretty robust. It allows us to do non-face-to-face type visits. So we have telephonic appointment availability and video visit capabilities. So since March, we've had that in place, but since March, we've actually relied heavily on that, so that we do have some physicians who their full day is virtual visits, telephonic or video visits, which has allowed us to, if I can use the term, redeploy our staff in different ways, so that even though we are focusing on COVID-related symptoms and COVID-related illnesses, we still can't lose sight of the patients with all the other illnesses, the hypertensions and the diabetes and the cancers and all of those things need to be looked at. So we do these outreach calls. We're able to do these virtual visits and video visits to help take care of some of those. We do COVID testing and COVID screening at 2 of our centers here, 2 of our medical offices in Palm Desert and in Indio, so we're able to do that. Currently, we did have to close the Palm Springs office
Okay.
because of space, so social distancing. So right now we have operations in Palm Desert and in Indio.
Gotcha. Okay. Well, thank you very much for sharing. And CJ, if you could talk about the same topics and so forth, programs, initiatives that DAP is doing. And I'll be the first to say that if not for Leadership Coachella Valley, I would have just thought you guys dealt with AIDS. I didn't know that you guys deal with all of healthcare. So if you could share.
And Sean, you're not alone. A lot of people don't know that Desert AIDS Project, we have primary care for people who are HIV negative. We have an infectious disease clinic. We have trans care, women's health. We have behavioral health, dental, and on-site Walgreens pharmacy, LabCorp, a wellness center, you name it. And it's for anybody in the community. So that's an important message, I think, for everybody to know. If you feel that you're kind of at a roadblock or you need some guidance in life or to get back on your medical journey, walk in these doors and we'll connect you to a service either internally or externally, whatever the preference would be, and depend on our community partners to help support these patients as they go through their journey of life. But specific to DAP, I mentioned before, the third week of March, we opened the COVID-19 triage clinic to alleviate traffic to the hospitals. And we just hit our 3,000th patient this week. And 800 of those patients were already DAP patients, but 2,200 of them were not. And the holistic model here at DAP, which, the teeth are connected, are inside of the face, which is connected to the brain and it goes to the heart. So it's all simultaneously the domino effect. And so we've been reaching out to all 2,200 of these COVID-19 triage patients just to assess insurance, to provide them community resources, to see if they followed up with their primary care doctor, if they're getting offered virtual visits and educating them about COVID. And so we've been following up with all of those patients that have came through that triage clinic. We've also launched an at-home delivery service for food, essential items, and medications through the community health department. So any patient that is tested at that COVID-19 triage clinic, who may be a patient of a primary care doctor or a case manager, and they don't have a loved one or a friend to be able to deliver any items that they may need at home, we have staff that are taking orders and delivering that to the patients at their home. And I think that's been one of the biggest things that the patients specifically have really liked. And it was just mentioned before about the COVID crisis really impacting the needs of other health conditions of patients or other services that we provide. And I think it really came to light when the virtual visits were being done by the clinicians with their patients. And then patients need to go get lab work done, right? They need to go get testing done. And we saw a decrease of roughly 80 to 85% of traffic coming into our on-site lab work. And so we immediately responded by taking our HIV and hepatitis C testing mobile unit and putting it in the DAP parking lot and essentially using that as a STI testing and follow-up lab unit for those patients. So they felt safer in a mobile unit that was getting cleaned properly one-on-one as opposed to coming into a clinic, even though we are obviously following CDC guidelines and making sure everybody's screened properly, but it's really just all about what makes that person feel safe. And so we like to provide options, and we did that. I also want to mention one other thing that we did, which was going to be when people were completing virtual visits, we noticed that the no-show rate, it went down, right? People were available. However, there's still a select patient population that we serve that don't have phone access. And so what we've been able to do is we'll bring people on site and meet with them outside and give them a phone to be able to complete their telemedicine or virtual visit with their doctor. And that's something that we're just now really trying to launch and get that out to those patients, because we're really, I can say I'm personally trying to make sure that the divide between access to services does not broaden through this COVID crisis. I know it's kind of inevitable, but to hopefully reduce it as much as we possibly can.
Excellent. Well, thank you very much. And I love that you guys have been able to pivot and change as needed. That's fantastic. And Rich, if you could share what's going on. Geez, you got the high desert, you got the East Valley, you got the West Valley. If you could share what's going on with you guys.
Yeah, sure. Thinking about the question, I should probably kind of think about, there's patients to think about, but also visitors. I think that was one of the the major changes are early on, especially when we didn't know as much as we even do now about the virus itself. We had to change simple things like we used to have multiple entrances. Basically, you can only get into the hospital as a visitor or patient two ways now, ER and a main lobby, and they're very tightly monitored, which was a change for folks. And really, visitation got turned off very quickly, which can be a challenge for patients, right? So a lot of changes to the entryways, and also, you almost had to have dual paths through every entrance, right? Because if respiratory symptoms, you've got to keep them on a track, not just for their own safety, but to maintain the confidence of the people coming for other things, right? That's a big change. Everyone used to come just basically through the same door, went through the same process. And so they had to be separated, and that can be disconcerting. You have to communicate that well. We had a lot of changes to our entrances and signage and things that we had to make. And the visitation has been, it's tough for people because they're used to having their friends and family. And when you can't have that, we had to spend a lot of time thinking about virtual ways of doing that, helping patients with their devices, providing an iPad if they don't have a device. It's very, very hard, but essentially you have to be a very, very sick person to have a visitor now. You kind of have to be on your own, and there's little challenges even just getting things to patients when they need, little things from home and stuff like that. So a lot of changes there. I think what I found was that the nurse, it really put a lot more on the nurses and the caregivers because they kind of had to fill in that need for emotional support. Not that they don't always do that, but it was just even more to try and make them feel at home and make them feel some sort of connection. And we really heard that because I did some focus groups with some patients early on in the virus just to understand what they were thinking about and what concerns they had. And that came up. We asked a lot about visitation. Is it hard? And many people said it was hard. Although some people said, I'm glad it's quiet because, I like my people here, but I don't want everybody else's visitors coming by me. So there is that flip side of it too. So we spent a lot of time with that. We talked with our providers, and then if there is a silver lining, I really think this made us all think about our healthcare providers in a new way, or maybe a more deeper way, and truly committing to providing us the help they give us. And so, as doing the marketing side of things, we did spend some time, and there's some really cool videos on our site where we did a series of videos behind the mask, because that's another challenge for our providers. They're all masked up.
Yep.
And it's hard to emote through a mask. So we wanted to do something that kind of highlights them. But it's been very heartwarming to see the public's reaction. They bring in lunches and they bring in things, and they want to reach out to the providers who are helping them. They know it's tough. They know, you can't imagine how the nurses in the COVID unit have to wear PPE 12 hours a day.
Yeah.
They all had 12-hour shifts, but 12 hours in an N95 mask can get pretty tough. So
Yeah.
that was really nice to see, and we've been trying to create programs as much as we can to help that whole process for both patients, visitors, their families, and the providers themselves.
Okay. Well, I'll tell you, I had the experience in the last 12 months where I was a patient at Eisenhower where I had a back surgery. And then my daughter was born at Desert Regional September 2nd. She'll be 1 year old here soon. And I'll tell you that I had an amazing experience for both of those times and so forth. And I'll tell you what, not being able to see people might have been tough, especially with the birth of my daughter, having friends coming in and so forth. But then also I know that I was shocked that we were home in 2 days. But I'm sure nowadays with birth and pregnancies and anything, you're trying to streamline them, get them home to their environment. Yeah, so, wow, some amazing changes there. So this next question, I asked about stats to share. So I could start this off with, one statistics I'll share, and Susan, I hope I'm not stealing yours. Desert Sands Unified School District, since March until last Monday, served over 1.6 million meals during meal distribution at our 10 different sites that were going on Monday and Wednesday from 8 to 10 o'clock, spanning from the border of Indio Coachella all the way to the border of Palm Desert Rancho Mirage. So if anybody else has a stat like that they would like to share, and we could just kind of go, if anybody just wants to share, I would love to hear something like that. Nothing?
No, I have one.
Go
for
ahead.
sure. We We had our peak when the Air Force arrived, or just a few days before the Air Force service arrived here, where we were seeing over 90 patients in the hospital at that time with COVID. Our intensive care unit was essentially 100% full. The hospital itself was about 80% full. And we were really facing some serious staffing issues and so on. I'm happy to say that as of today, we've seen 14 consistent days of decrease in the number of cases that we're seeing in the hospital.
That's great
now,
news.
Yeah,
Great
absolutely. News. We're down into the high 20s now in terms of total hospitalized patients with COVID. I think another important thing is that we saw, as we hit that peak of 90, we definitely saw a trend where we were seeing a very large number of patients that were coming from the east side of the valley, where the home situation was one where there were several other family members at home that were positive. And we were basically seeing entire families infected, some of whom were having to come to the hospital to be hospitalized, some of whom had to be in the intensive care unit on ventilators and so on. And while we still see patients from the East Valley, we're really kind of back to seeing a spread just here and there across the valley, rather than those large numbers of family members that are all coming in one after another. So I think there's very positive trends on those fronts. And then the last is that our positivity rate is definitely going down as well. Still higher than we would like to see. The last few days have been remarkably low. In fact, day before yesterday, I think we did 63 tests and only had one positive. 63 of our own internal rapid tests that we do.
Okay.
So definitely seeing a decrease in the positivity rate as well. So while we're not done with this, and we still have to be cautious and not get ahead of ourselves, as I think we did in May and the 1st of June, it looks much more positive now.
That is great news. Thank you for sharing all that. And Rich, go ahead.
Yeah, I'll just jump in because we're seeing the same thing. You're probably wondering about the other hospitals. I was just pulling up the county's data, and it really has come down. Now, in District 4 for the county, all 3 hospitals only have 96 patients. And, we were up flirting with 200 at some point earlier in the summer. And so we're seeing the same thing with positivity rates in our in-hospital testing, where you would expect it to be higher since that's where people come when they're sick. So that's great news too. The only thing I'll throw in there is now we're talking about, this is great. We've bent the curve again, feels like again, but Labor Day is coming up, guys. Yeah. Do not go to parties. Please stay with your people in your household and put your mask on. That's what I have to say.
Great recommendation. One other stat I want to share before I move down to you, Patrick, is I want to say on behalf of Desert Sands, thank you to Kaiser. To let you guys know, Kaiser Permanente doctors and employees and staff supplied 135 backpacks for some of our most neediest students. So thank you for that. So that's another stat I want to throw there. And Patrick, is there anything else that you'd like to share in regards to the clinics and so forth? Oh, geez.
Thank you. Yeah, sure. I think similar to what I've heard. Similar to what I've heard, I think we've seen that too. So I've got, I can't share data just yet, but anecdotally, what I've seen is, even though we believe that the social distancing and the stay-at-home measures have certainly helped, I'm seeing that here. I mean, Coachella Valley has always been for us a destination for some of our other members. I usually see people from Northern Cal, from Washington and Oregon State who are members up there. Colorado members coming down here, and this year that kind of seems to have changed quite a bit. Interestingly, I was up, I had to go up to Vancouver, Canada, where I'm from, in the early part of this pandemic, and even the Canadian snowbirders were heading home in March, and I squeezed myself onto a plane that they dubbed, a repatriation evacuation type flight. Snuck on with my Canadian passport type, but really that's what we're promoting. We want the stay at home. We want the social distancing, mask usage, all of those measures that help, like you say, flatten the curve or bend that curve. So yeah, absolutely.
Excellent. Thank you very much. Susan, is there anything that you'd like to share in regards to stats and so forth? You're muted right now, Susan.
I think everyone else has pretty much covered the stats. I follow the health department pretty closely and those numbers and watch those go up and down. Pretty impressive, Sean, the meals that Desert Sands has been able to provide. Now I have no other stats to share.
Okay, no problem, no problem. And CJ, anything that you'd like to share before we kind of wrap up things and so forth?
Absolutely. So my feedback on data really, it kind of replicates what everybody's saying. When the hospitals are seeing 80 or 90 patients, we look at our positivity rate at the COVID-19 triage clinic, and we're saying, well, we're testing at a 15% positivity rate right now. And it's really interesting when you look at the graphs that Dr. Foltz, our infectious disease doctor here at DAP, has created, and he'll even put on there when restrictions have been tightened and when they've been loosened, and then looking at that positivity rate, and then we compare that with the reports we get from the local hospitals as well. And it all really does come together when you look at it, as far as if you adhere to, physical distancing and people stay home and they wear their mask, it is very, very effective.
I agree with you completely on that. And one question I have, so I would say that I knock on wood, I'm relatively healthy, but I want to have that positivity rate be in the way that we want it. Would you suggest people who are healthy to go get tested so we can have that positivity? And this can go out to all of you guys, please. Do you suggest that everybody go tested so we can see that positivity rate, or should you only be tested if you're experiencing symptoms? And I'll go with Dr. Alan Williamson.
Well, Sean, ideally, there's no question we'd love to have everybody being tested and really understand what's going on in the population out there. That's normal public health policy. Normally, if we have an infectious disease, what you want to do is identify where is it, identify the groups of people that are potentially infected, potentially spreading that virus, and isolate them. And this pandemic has been 180 degrees the opposite direction. We've basically been chasing the disease the entire time. And until we unfortunately have testing that's much more available than it is right now, I just don't foresee we can do that. I think we need to still focus on the people that we absolutely do have to test so that we can be sure we can deliver the right care for them. Are they infected? Are they a candidate for the convalescent plasma, for remdesivir, et cetera? Those people we need to test. We need to test those that are coming in the hospital even without symptoms to try to be sure we're protecting our staff, protecting the other patients in the hospital. So at this point, unfortunately, we're basically flat out with testing just to do the things that we know we really have to do. I can't wait until we get to a situation where we can actually start testing everyone and understanding a lot better what's going on in our community.
Right, I understand that completely. Is there anybody else that want to touch on that?
I might just throw a shout out to the county. I mean, Dr. Williamson is exactly right. It's very hard to test. We're experiencing the same tightness of supplies, reagents in the lab that they are. But there is a site to go to, so people can get tests. I know the delays in getting results is the biggest issue now, and it's a shame that it takes days and days to get a test result, because that obviously affects your ability to do anything with that result. But we should probably say the county is doing testing. So if you go out to the county website, rivcoph.org/coronavirus, there's a ton of information. And I think the county's been doing a good job of keeping the information out there. There's a button to click there for a list of test sites. You can get a test. It's just until the supplies, I think, start coming better, the delays are going to continue to be there. So let's hope that they can get on top of that. That we all want to see that. Almost as much as we want to see that vaccine, right, Dr. Williams?
Yeah.
Yes.
Yeah.
Yeah.
Gotcha. CJ or Susan, anything you'd like to add in regards to that?
The Riverside County Health Department does meet weekly with education partners, and they did mention in their meeting yesterday that demand for appointment-style testing is starting to decrease somewhat. So they are seeing a decrease in that. They still have all of their walk-up clinics. You're right, Rich. They have a wonderful website as well as an app for your phone that's pretty easy to maneuver, and there's a place right on the app to click a button to schedule testing. As far as lots of other information as well.
Excellent, excellent. Yeah, you always got to be careful what you just hit into Google. So I'm glad that you guys gave specific resources to go to. You never know where it's going to lead you off to. Now, yeah. So I promised you guys I was going to try and get you out of here by 12:15, and we're coming up to about 12:10. As we wrap up, is there any message or anything you'd like to say to the people that are watching or the people that will watch us in the future? CJ, is there anything that you'd like to say? Oh, and I'll come right to you, Rich, next.
Yeah, absolutely. So it's not really going to be healthcare related at all. It's more so about our mental health and taking care of ourselves, because we're kind of all going through this together. And we're all going through different stages of grief right now, whether we know it or not. If we don't know it, it's going to hit us. And we're all in a different stage at a different time. And we're letting go of what used to be and trying to live through what currently is, in these, being scared of the unknown, which is the future. But what I think is beautiful about this is we've really taken this crisis and turned it into innovation across the entire world. We're doing things that we never thought were even possible. So I look at this as being an opportunity for people to communicate, to collaborate, to be compassionate, to be understanding. This is not the time to point fingers or to yell at people that, for wearing a mask, not wearing a mask, or whatever it may be, but to support each other and just to listen to each other, how people are feeling, and just co-create the best imaginable future that we can together. Because really the future, it's whatever we want to make it.
I love it. Great attitude with that. Thank you. And Rich?
Yeah, and I guess I've sort of already said the main messages, but I'll repeat them again because they're important. The first one is, if you're feeling signs of a stroke or have chest pain, your emergency departments at any hospital in the Coachella Valley are fully prepared for COVID. It's been a challenge, but we've always dealt with infectious diseases. We've got all the measures in place now. So come prepared. Do not stay at home because you're afraid. That's the main message. And then the other one I would say, I kind of joked about it, but it is very serious. We do have a holiday coming up. Labor Day is not the time to hang out with people outside your household as much as we want to do it. You have to remember that we had a success. Let's not lose ground. So those would be my two messages.
Okay, thank you. Dr. Alan Williamson?
I would agree 100% with what Rich said. I would just add that if we want to see schools get back into in-person education, if we want to see businesses reopen, if we want to see restaurants reopen so that we don't have to deal with all the isolation we're talking about, then it shifts the responsibility to us as individuals. So people do need to just take ownership of the fact that they're responsible for their health, their family's health, their friends' health, anyone they contact. Social distancing works. Face masks work. There's great studies out there now to really show the effectiveness of face masks. There's really no debating that. I understand no one likes it. I don't like it. I had to shoo someone out of the room here so I could take my mask off so I could actually talk to you all with my face exposed. But it does absolutely help us to stop the spread of the disease. So if we want to get back to normalcy, which all of us want to desperately get back to something more normal, we just have to continue to push for that. We've gotten it to flatten out again. We've gotten back into the decline. We've got to keep that up. It's not the time to keep the foot off of the brake. We've got to just keep pressing on this. Another few months, we can get beyond this.
I love it. I love it, definitely. And Susan, is there something to say as a message to our viewers and so forth?
Just to piggyback on that, continue to social distance and wear your face mask. Stay away from others when you're feeling ill. Wash your hands, wash your hands, wash your hands.
There you go. There you go. There used to be a school nurse, Michael Lean, who was in charge at Desert Sands. I don't know if you knew her, Susan, but I worked with her at Palm Desert High, and every year we had the hand washing conversation as part of our staff meeting. And she would take 10 minutes to talk about hand washing. We all were laughing. We used to laugh at her, and I'm glad that I listened to her. Definitely. And Patrick, is there a message that you'd like to say to our followers that are watching right now?
Yeah, I think I'm going to echo everyone else. I mean, the social distancing works. Let's be vigilant. Let's keep that distance. Wearing face coverings certainly has worked. Frequent hand washing, and if you choose to use hand sanitizers, making sure that it contains 60% alcohol or better. That's the most effective for it. But really, following up on what CJ was saying, that's key and that's important. socialization for not only our younger folks, but our older population who may feel isolated. Now's the time to reach out. It might be a phone call, it might be a virtual call. It didn't appear that way for me at the beginning of this visit, of this web feed, but we have gotten better with Zoom conferences and StreamYards and all of this virtual visiting stuff. So let's use that. I mean, my folks are up in Vancouver, and I've got to rely on that to touch base with them. So keeping ourselves not just physically, but the psychological and the emotional pieces in check. I think that's important too.
Most definitely. And guys, I just want to say, go ahead, Dr.
Oh,
Wynn.
and
Yeah,
flu
if we have one more minute, I just want to
Get a flu shot.
piggyback on something that Susan said that reminded me of something very important, and that is if you become symptomatic, regardless of where you are, working in a hospital, working in a school district, working in the supermarket, if you develop symptoms, if you start getting a sore throat, you start getting headaches, you start getting really fatigued, start having cough, shortness of breath, please stay home. It's really amazing how many educated healthcare people, doctors, nurses, staff in the hospital, even though we harp on this every day and we all worry about it every single day, still show up to work, and it's only the second or third day say, hey, by the way, I've got a cough and fever. And we've exposed, Rich is laughing. I'm sure he sees this at their hospitals as well. It really is remarkable that we have to pay attention to that. If we become symptomatic, please, no one's going to blame you if you stay home an extra day and turns out it was just some sniffles from your allergies and so on. I would much rather deal with that than have to deal with the fact that now we've exposed another 10 coworkers to someone who had COVID. So if you become symptomatic, please take it seriously.
I agree completely. And just so you know, we've had some live viewers and comments. I just want to make sure to put them up here. Lee, thank you for watching. She put up thanks for everyone for the great information. And then we also have, I know, one of our LCV alum, Paula, who said great information too. So I want to end on that, guys. Thank you for taking the time. Thank you for doing what you do for the community and doing what you're doing for healthcare and being leaders in the community. We greatly appreciate it, and I hope that we can reconvene with our LCV classes soon, and we can have a healthcare edition where we physically get to meet. Yeah. Well, thank you all. You guys have a great one. Greatly appreciate it. Have a great one.
Thanks,
Thank you all.
And with lunch conversations, guys, just so you know, in 2 weeks we'll be back. We have our Desert City leaders. We've put out invitations to all of our city councils and mayors and so forth. So anybody that wants to participate, we're looking for one participant from each city. We've already got some people that are lined to be part of this, but if you're interested, the information down there below, please email us. All right, guys, have a good one. We'll see you later.
Thank you.
Okay.